Okay, this video is called When a Family Member Goes for Surgery, What to Do. This was recently asked of me. So there's a couple questions you got to ask. Does the patient really need surgery? You'd be amazed at how often the patient really doesn't need the surgery. For example, a very common operation is open heart surgery called CABG, coronary artery bypass graft. Well, guess what? You get better results from just routine garden variety Esselstyn diet for routine atherosclerosis of the coronary arteries. I mean, if there's special situations that might affect your planning and the acuity of the problem and things like that, but in general, the Esselstyn diet is the best treatment for coronary artery disease. So why not do that? There's no side effects. CABG is a big operation, I'm always amazed. Patients that say, no, I don't want that vegan diet. But, oh, yeah, go ahead. Open up my chest with a buzzsaw and take, the veins from my legs and staple them onto my heart. Oh, that's no big deal, but eating a vegan diet's a big deal. Stupid. Okay, the next thing is joint replacements. Lots of people, they go get their joints replaced, their knees, their hips, everything, Maybe you've got an end-stage joint and that might be for the best. But what I'm saying is, if you're fat, why not just lose the weight? And if you want to lose the weight, study the people who lose the weight. A billion out of a billion rice-eating Asians, they're all skinny. So do something like that. So I know how people think, though, and I can tell you, I've seen a couple people die from knee replacements. Don't get me wrong, most of the people have a knee replacement. They do pretty well. But you could die, okay? And I've seen people die who were healthy. I know a very famous physician who took care of patients with spine problems. I'm not going to go into any more detail than that. He got 5 infections that just kept recurring back and forth. He was in septic shock, in and out of the ICU. And this was like a very well-known doctor, okay? He had the best of the best and everything, and it still happened. So what I'm saying is, you don't go for surgery if you don't have to. I'm 59. I never had surgery once in my life. I don't want to ever have surgery in my life. It's not like some inevitability. The way you protect yourself, we talk about it. Low fat, low sodium, vegan diet. All right. So anyways, so first of all, do you really need the surgery? Also, what I've seen is some of these private practice hospitals on fee for service, they're desperate for money. They're more likely to push the patients towards surgery. Also, patients are scared. Oh my God, I've got cancer, prostate cancer. Oh my God, cut it out, just cut it out. I don't want to have it in my body, cut it out. That doesn't improve your prognosis, okay? I mean, it depends on the type of prostate cancer. But, the old saying is don't just do something, stand there and think, okay? The whole Ornish study, they got really good results with the vegetarian vegan diet with low-grade prostate cancer. So it depends on the patient and the situation. But all I'm saying is the typical stupid person rushes into surgery. They think, oh, as soon as I have the surgery, that'll solve all my problems. Whereas people who really know a lot about medicine and surgery, they're like, is there any way I can avoid having to have this? I mean, don't get me wrong. Sometimes you need it, but you don't just jump into it. What else? What type of anesthesia? For any medical procedure, you want to know what type of anesthesia if you have to have any. I can tell you, I had to go for colonoscopy. I didn't really want to go for colonoscopy, but my mother died of colon cancer, so I figured I'll do it. This was many years ago. Gosh, like over 25. This is about 30 years ago that I did it. And so then I didn't want to inconvenience anybody needing to give me a ride. No, it was about 25 years ago. So I just, fine, no anesthesia for me. Plus, I'm scared of, some of those benzodiazepines, Versed, they can cause memory problems and stuff. I heard some people have a prolonged memory problem after that. I'm like, wanted to protect my memory, so I said none of that. So then I had the colonoscopy, then my family's making fun of me. You didn't need anesthesia for that. Did you enjoy it? All this type of stuff. And I'm like, you know what? I just got it over with. And now I eat so healthy. The endoscopist told me my colon was so normal it was not even funny. I have no idea to ever go through that again. That's another long story. And I haven't since then, and I feel good. Okay, private practice hospital, we talk about that. And also, here's the way you ask a doctor a question. You say, what would you do if your family member had this problem or if you had this problem yourself? The point being is, initially, doctors in what you would call a referral loop, they have to do, to some extent, what the physician who referred them, the patient, expects. And they must maintain that expectation, otherwise they won't get referred any more patients. And in general, there's a standard of care. Everything goes by a standard of care. And there's what's expected. So they pretty much have to go through that version of the situation. And so the only way you can get around that is if you ask them, what would you do if you had the problem or if your family member had the problem? Then they could potentially talk like they would talk to themselves, if you will, how they might do the Esselstyn diet or they might try weight loss And it's good if you can speak to a doctor not associated with the hospital where you're planning the surgery, because they will give you an off-the-record opinion. They don't have a dog in the fight, so to speak, and they can just tell you what they think. Is it a good idea or not? And they don't have to worry about pleasing the referral service or making money for the hospital or making money for the group. None of that stuff. They can just tell you what they think in that situation. Ask what day the surgery is. In general, Monday to Wednesday is the best. Thursday's okay. Friday tends to be bad because a lot of times, the big shot surgeon who does the case is on vacation the next day, and you're being covered by, junior intern. Like, for example, you don't want that in, the beginning of July if you can avoid it for an elective surgery, because the interns, they don't have that much experience. So you want to know who covers on the weekends, and again, try to get it earlier in the week, and hopefully you'll be home by the end of the week. Okay, find out who the best surgeon is. Usually the best surgeon is going to be somebody who has a lot of experience, has done a lot of cases. They know everything that can go wrong, so they can anticipate it and prevent it. Nurses will often know, and they'll often tell you if you know any of the nurses. Try to get an off-the-record opinion. On the record, everybody has to go with the script. But if you can get an off-the-record opinion from somebody from another hospital or somebody who just knows the different surgeons at the place, maybe you have to go to a particular hospital, but find out who is the best surgeon, who's got the most experience, who gets the best results, if that's possible to find out. Does that surgeon have a lot of experience? You can just ask them, how many of these have you done? Okay. Let's say they're taking the gallbladder out. How many cholecystectomies have you done? Does the hospital have a lot of experience with the procedure? Because you also want a place where the nurses in the post-op ICU have a lot of experience dealing with patients with this condition. So any problems will be caught quickly, be managed effectively. Does the surgeon have the A-team for that day? For example, I was an imaging-guided surgeon earlier in my career, interventional radiologist, and I knew that if I had the experienced techs with me, the experienced nurse, it would be easier to get through those cases. They would know when I asked for a piece of equipment, they would know what it is, and they would find it quickly, okay? They could assist me more. So I just knew it would be an easier day when I had the A-team. Who's the best fellow or the best OR nurse? Are they going to be working with you, the best team you have for doing these cases, your surgical assistant? Who is doing the surgery? Is it going to be the attending? Sometimes the person doing the case is going to be the junior resident. You want to know in advance, am I having somebody experienced do this procedure on me, do this surgery on me? Is there any pre-procedure preparation? Like if you're smoking, maybe, and it's an elective surgery, maybe you can delay it for a while so you can quit smoking. That might help you for healing post-op, for example. If you drink coffee, you might want to wean yourself off the coffee before an elective surgery so you don't get coffee withdrawal headaches, on the day of the surgery in the immediate post-op phase. Be aware of how you can optimize blood flow. That's going to improve your healing. Low fat, low sodium, 100% organic, whole food, vegan diet, okay? A lot of surgeons don't know that. In my experience, probably the vast majority of them aren't aware of that. Better blood flow post-op will help the wound to heal more effectively. Family members, if possible, should sleep in a cot in the hospital room with the patient, especially for bigger surgeries, because patients will sometimes be confused. They'll wake up in the night, they'll maybe pull their lines out. My mother had to go for surgery, and I slept in a cot in her room in the ICU for the whole time. And my mom, her personality, she's always cracking jokes, and she'll sometimes go back and forth between Spanish and English and tell jokes. And if you didn't know her, you'd think she was crazy. But I know her that she's making jokes. She's constantly joking about everything. She's very funny. So that way, she's not confused, and you can help with every little thing they need. A lot of times there's all kinds of little issues they need, and the nurse isn't always immediately available. So you got to be real nice. As a matter of fact, when I requested to stay in the cot in the ICU with my mother, the nurse tells me, oh, no family members allowed in the room. I'm like, BS. Let me talk to the head nurse. So I talk to the head nurse. The head nurse goes, no, sir. No family members allowed in the room. I said, no, that's not good enough answer. I called the chief of the ICU, the chief physician. I said, I want to be in this room. And so they let me stay in the room. And that's what you should do, because, it really helps them to have a family member in the room. Okay, you got to be, real quiet and good and don't annoy the nurses. But having a family person there, it helps. Also, when you go to hospital, always dress really nice. Dress in your best clothes. Don't ask me why, but it's just a fact. You get treated better in a hospital when you dress nice. You do. You get treated with more respect. They assume you're intelligent, and you get the benefit of the doubt on all kinds of things, versus if you look like an idiot, you get treated like an idiot. I know that's not right, but that's just how it is anywhere I've ever seen in my life. They don't know you, and lots of patients, they're cognitively impaired. There's all kinds of goofy things that happen Whereas if you're dressed nice, they just assume you're more with it. And you just get the benefit of the doubt on stuff. I've seen that plenty of times. Okay, let's see, what else? Patients sometimes wake up confused. We talk about that. You can also look. You'll see weird things. When my father had open heart surgery, he should have done Esselstyn diet, but again, this was many, many, many years ago, and I didn't know better at that time, and he didn't know better, and the cardiologist pushed him into it. The surgeon pushed him into it, and I thought about Ornish, but I didn't come down strong enough. It was many, many years ago, decades ago. All right, so anyways, they ran my dad's blood pressure really low in the post-operative phase after open heart surgery, cabbage. And I said, well, why are you doing that to anesthesiologist? He's like, oh, we don't want him to bleed out at his anastomoses. And my dad came out of it fine, no cognitive impairment in the immediate post-operative phase. But I wonder, other patients probably had, my dad was relatively healthy for that surgery. I wonder what other patients will often have more cerebrovascular atherosclerosis if they're at increased risk for silent stroke, so to speak, so-called pump head. Let's see, what else? My aunt. It's good to get moving post-op as fast as you can, as long as you're comfortable and you're able to. Don't obsess about the pain. Try to focus on getting walking. The sooner you're walking in the post-operative phase, the sooner likely you are going to go home. And just to give you a little perspective on people who know what they're doing, I have an aunt who's 78 years old. She's a really smart lady. She graduated first in a medical school class. She fractured her hip. She had her hip pinned, fixed. ORF is open reduction, internal fixation. And right on the first day, she said, I'm going home. She signed AMA against medical advice. She removed her IV. She said, and they said, well, aren't you in pain? She goes, I can live with the pain. I just don't want to sit in this ICU and, sit around in bed, get a blood clot in my leg, a DVT, deep vein thrombosis, maybe a pulmonary embolism if that DVT moves up to the lung. Don't want to get a pneumonia. So she just went home, and she did great. She was working again pretty soon after that. Okay, I have another friend who's a general surgeon. This is back in the 1990s. He didn't know that much about atherosclerosis. He ended up getting a coronary artery bypass graft surgery. He went home on the first post-op day. He says, I'll be okay. I can handle the pain. I know what I have to do, get moving. And he did great as well. So I'm just telling you, those are people with a lot of knowledge and experience. They want to get moving and go home fast. They have a clear sense of purpose on what to do and what to expect. So anyways, the family member has these problems. All this stuff is helpful. Sometimes if you have a doctor friend, let them know in advance and that you can contact them over the course of the days in case there's any issues. For what it's worth, you can get their opinion on it. So anyways, hope that helps.